Hello everyone, I'm Rita Saikali, and today I'm going to discuss generalized anxiety disorder, or GAD, which is a condition within the anxiety disorder category in the DSM-5 TR. This disorder has profoundly affected millions of people worldwide, interfering with their daily lives, their relationships, and their overall well-being. By understanding its assessment, diagnosis, and treatment, we can offer hope and effective strategies to those struggling with persistent anxiety. Now, why did I choose this disorder? Well, I chose GAD for a couple of reasons. First, anxiety is one of the most common mental health challenges today, and it's often misunderstood or overlooked as a normal stress. But for people who are struggling with GAD, their anxiety goes beyond their everyday worries. It's persistent, it's overwhelming, and it's often uncontrollable. Secondly, on a personal level, I've seen how debilitating anxiety can be for individuals trying to navigate work, family, and personal goals. To diagnose the GAD, the DSM-5 requires that a person experience excessive anxiety and worry about a variety of topics and events or activities for more days than not over a period of at least 6 months. This worry is not only intense, but also often difficult to control. The anxiety must also be accompanied by at least 3 or more of the following 6 symptoms. 1, restlessness or feeling on edge, fatigue or getting tired easily, difficulty concentrating or a cessation of the mind or your mind going blank, irritability, muscle tension, sleep disturbance such as trouble falling asleep or staying asleep, or unsatisfying sleep. For children, only 1 symptom is required to meet the diagnosis threshold, and additionally, these symptoms must cause significant distress or impair the individual's ability to function in social, occupational, or other areas of life. And finally, the symptoms cannot be better explained by any other medical or psychological conditions. Now, how do we assess these things? Well, diagnosis of the GAD requires a comprehensive approach, and this is how I would assess someone suspected of having this disorder. Number 1, I would conduct a clinical interview. A structured or semi-structured interview helps gather detailed information about that individual's worries, their daily lives, their functioning, and the history of the symptoms. I pay attention to how anxiety impacts their relationships, work, and overall quality of life. 2, screening tools. So evidence-based questionnaires like the General Anxiety Disorder 7, it can help quantify symptom severity. So when you're looking at a score of 10 or higher, that often indicates clinically significant anxiety. 3, behavioral observation. So during sessions, I would observe physical signs of anxiety such as restlessness, fidgeting, or difficulty maintaining focus. 4, I would rule out any other conditions. Since the GAD can overlap with conditions like hyperthyroidism, substance-induced anxiety, or other mental health disorders, I would collaborate with medical professionals when necessary. And number 5, collateral information. So when appropriate, I'd involve family members or close friends to get a fuller picture of the person's functionings and their behavior. Now let's talk about treatment. Research shows that GAD is highly treatable with a combination of psychotherapy, medication, and lifestyle adjustments. Here are the most effective strategies. Number 1, cognitive behavioral therapy, or CBT, is considered the golden standard when treating GAD. So CBT helps individuals identify and challenge disordered thoughts, patterns, like catastrophizing or overgeneralizing that fuels anxiety. Techniques like cognitive restructuring and behavioral experience, well, that helps reduce the intensity and frequency of the worries. Number 2, we have acceptance and commitment therapy, so ACT. And while it's similar to CBT, ACT actually emphasizes accepting anxious thoughts rather than trying to eliminate them. And so it encourages individuals to focus on what they can control and live according to their values. And number 3 is pharmacotherapy. So for moderate to severe GAD, medication can be effective options. So you have things like sterlins that are often the first line treatment. You have buspirone, which is an anti-anxiety medication specifically designed for GAD. And you have other medications that are effective in short terms but are generally avoided for long-term treatments due to their potentials for dependency. And number 4, you have mindfulness and relaxation techniques. So when we're talking about mindfulness, meditation, deep breathing, and progressive muscle relaxation, well, it helps reduce physical symptoms such as anxiety and muscle tension and rapid heart rate. 5, lifestyle modifications, so encouraging exercise, a balanced diet, a good sleep hygiene can generally or greatly enhance the treatment outcome. And psychoeducation, which is education or educating their clients and their families about GAD, can be powerful to manage the symptoms and reduce the stigma. So how does researching this disorder has enhanced my understanding of it? Through my research on GAD, I've gained a deeper appreciation for how interconnected biological and psychological and social factors are in shaping medical health. Professionally, I've learned the importance of tailoring treatments to each client's unique experience, as no two cases of GAD are exactly alike. And this research has also reinforced the value of evidence-based approach like CBT and the need for collaboration between therapists, physicians, and clients. And, well, on a personal level, exploring GAD has heightened my empathy for individuals living with this chronic anxiety. I now better understand how overwhelming it can feel to constantly battle the what if thought and the physical discomfort, and how small victories like sleeping through the night can be life-changing for these individuals. Thank you for watching, and hopefully I'll be with you in the next video. Bye for now.